Welcome to In Prime Health, where we are honored to care for you as a member of the Prime Healthcare family. We're pleased to share information about the Prime Healthcare Employee Health Plan, with excellent options for everyone at any stage in life. This presentation is your guide to Prime Healthcare's medical benefits. We will discuss coverage options, the Prime Healthcare EPO plan, understanding your benefits, the referrals and authorizations process, where to go for emergency care, lab, imaging, and X-ray services, and what to do when you need help navigating the Prime network. So, let's get started. You and your dependents have access to a best-in-class health plan that is growing every day, one that offers quality, compassionate, and award-winning care at little or no cost to you. We want you to be cared for in the same way you care for the communities that we serve, and to keep you in prime health. There are many options to choose from when selecting your Prime medical coverage. The Prime EPO plan enables your family to access the Prime Healthcare network to its fullest. The Medical Expense Reimbursement Program is an option for those who have medical benefits through a spouse's plan. And the Value Plan is an additional option. Details are in your benefits guide. We'll go more in depth regarding the EPO plan in particular, as it's our most popular plan, and importantly, there's little to no cost to you. Some members may have other options to consider as well. For those over the age of 65, you are likely eligible for Medicare. Before you decide on your medical benefits, it is important to understand all of your available options so that you can find the plan that's right for you. And although this is rare, some hospitals may also have site-specific plans that have been carried over for a limited time. Your hospital's benefits guide is where you'll find information should a site-specific plan be available to you. If you could be covered through your spouse's medical plan, the Medical Expense Reimbursement Plan, or MERP, could be your best option. Through MERP, you can receive reimbursement payments for copays, coinsurance, and deductibles. By combining your spouse's medical plan with Prime's MERP plan, you will effectively have 100% coverage for your medical costs. Best of all, the MERP plan is available at no cost to you. This option reimburses up to $8,150 for individuals or up to $16,300 for you and your dependents. The Prime Healthcare EPO plan is a tremendous benefit offered to our employees and among the best offered throughout the country. It delivers a high-quality plan and an award-winning network of hospitals at little or no cost, leaving you more to spend on what matters most to you. The EPO plan covers preventative care costs at 100% and covers most inpatient and outpatient hospital-based services within the Prime Healthcare network, which means in some cases an employee will not have to pay anything for their care. The Prime Healthcare network includes award-winning hospitals and physicians and is growing daily to provide even more services. Most of all, the plan strives to provide exceptional care to employees who are valued members of our own Prime Healthcare family. It's like family caring for family. Now, let's learn more about the Prime Healthcare EPO plan. Most medical plans in the United States are operated as managed care plans. That means they deliver health benefits and services through contracted arrangements between the plan and care facilities and providers. Prime Healthcare's EPO plan follows this managed care model, which is how we can keep costs lower for you when you seek care at facilities and with providers who are contracted with our plan. Remember, your health plan benefits are based on the Prime facility where you are employed, so using the Prime network will provide the least cost to you. Let's take a moment to talk about Prime. Thanks to your hard work and commitment to patients and communities, Prime Healthcare's clinical quality is nationally recognized. Prime Healthcare hospitals have been ranked among the 100 top hospitals in the nation by Watson Health a remarkable 47 times. What's more, For the last 4 years, Prime Healthcare has also received more HealthGrade's Patient Safety Excellence Awards than any other health system in the nation. As a Prime Healthcare employee, you and your dependents have access to our award-winning network of hospitals and more than 100 outpatient facilities across the United States. Let's hear a member experience. Within 2 months, I was in our emergency department twice. In both cases, I checked in, the registrar came in my room with her tablet, verified my information, rang up my debit card, and came back with a $25 receipt. After the assessment and needed tests, I was sent on my way with a prescription. They were the easiest visits to the emergency department in my life. Tracy, from a Prime location in the Midwest. Providers and facilities in our network are categorized into 2 tiers based on their contracted agreements with Prime Healthcare, Blue Shield of California, and for those outside of California, the Blue Cross Blue Shield Blue Card Network. The amount you pay out of pocket for services will depend on the network tier your provider is in. Tier 1 provides the maximum benefit at little or no cost to you and consists of Prime Healthcare providers and locations. Tier 2 consists of the Blue Cross Blue Shield network. Prior authorization is required to access provider services in Tier 2. Should you choose to visit a physician who is not part of the Prime Healthcare network, your visit may not be covered by our plan. So remember, look for Tier 1 providers and Prime Healthcare facilities to ensure you receive the maximum benefits. What's the difference between Tier 1 and Tier 2? Tier 1 provides the maximum benefit at little or no cost to you. Tier 2 providers are part of the Blue Shield of California or Blue Cross Blue Shield Blue Card Network and can be accessed when services and physicians are not available in Tier 1. Keep in mind that an authorization is required before member visits to Tier 2 providers will be covered. We'll talk more about referrals and authorizations later in the Referrals and Authorizations section. Accessing a Tier 2 provider starts by asking this question: is the service you need offered within the Tier 1 Prime Healthcare network? If it is, you must see a Tier 1 provider to receive the lower Tier 1 copay and maximum benefits. If the service you need is not offered within the Tier 1 Prime Healthcare network, or if your primary care provider refers you to a Tier 2 specialist, a referral request must be submitted to Prime Utilization Review. Your physician will submit this on your behalf to Prime. Prime Utilization Review will respond by mail with an authorization, or will contact you to direct you to an alternate provider if necessary. Remember, all Tier 2 services require prior authorization. We will cover the authorization process in more detail in the next section. The 1.5 Benefit Program was created to ensure that you and your covered dependents have access to comprehensive medical care at minimal out-of-pocket costs. If a Tier 1 provider for specialty services is not available in your area and you are directed by Prime Utilization Review to see a Tier 2 provider, you may be eligible for the 1.5 Benefit Program. With prior authorization, members may utilize the Tier 2 provider network but keep the lower Tier 1 copay, coinsurance, or deductible. When your PCP or specialist submits a referral request to Prime Utilization Review, they will review to determine if the service is available within the Prime provider network and hospitals. If no Tier 1 provider is available, members will be directed to a Tier 2 provider. The Notes section of the authorization will show whether the 1.5 benefit applies. Let's hear a member experience. After a very stressful event with my heart, I was able to find not just a cardiologist, but an electrophysiologist. Both of my physicians worked together to get me high-quality care without being worried about my insurance. It really made all the difference to myself and my family. Sky B, from a Prime location in the Midwest. Now that we've covered the tiers, let's talk about one of the most important decisions you will make for your health. That is selecting a primary care physician, or PCP. Choosing to fulfill your medical care needs at Prime Healthcare facilities with a Prime Healthcare provider who is in the Tier 1 network will ensure you keep your out-of-pocket costs low, and most importantly, you'll be connected with a provider who can oversee your care within the Prime Healthcare network. To find a Tier 1 provider, visit primehealthcare.com/EHP or visit the corporate benefits section of the intranet. You can also get help finding a physician by calling Prime Customer Service. Designating a primary care provider ensures you have a physician dedicated to coordinating your medical care and ensuring the quality of care you receive. Selecting a PCP in the Tier 1 network will ensure you pay the least out-of-pocket. Should you need the help of a specialist, your PCP must submit a referral for authorization through Prime Utilization Review, even if that specialist is in the Tier 1 network. If your doctor isn't part of the Tier 1 Prime Healthcare network, ask if he or she can join. Then email Prime Healthcare Customer Service at ehp@primehealthcare.com with your doctor's full name, address, and phone number. A Prime representative will reach out to your provider to share membership information and the simple one-page provider agreement. There is no cost to your doctor to join the Tier 1 Prime Healthcare network. And did you know that our Tier 1 provider network is growing every day? Locally, a member of your hospital's business development team is actively recruiting more providers into our network. You can help this process by emailing ehp@primehealthcare.com when you encounter a doctor who you'd like added into our network. As a Prime EPO member, you always have the right to request care at your preferred Prime facility. It is always to your benefit to request a Prime facility to ensure you have covered benefits and pay the least out-of-pocket expense. If your provider does not provide services at a Prime facility, they are welcome to join the Prime network or request privileges from a local Prime facility medical staff office. You can also choose to receive these services from a provider who can provide services at a Prime facility. Let's hear a member experience. People should really try using our own Prime Tier 1 doctors and services. Not only is there no deductible or copay, but you'll get treated by our own phenomenal care team. Peggy, from a Prime location in the Midwest. It's important to talk to your doctor about your benefits. Providers have many patients, and they may not be aware of your plan benefits. It's important to ask your doctor to keep you in the Prime Tier 1 network. It is to your advantage to stay within the Prime Healthcare network and receive services at a Prime facility because you will have little or no cost for these services. Prime Customer Service is happy to assist you and coordinate your care with your provider. Am I required to stay within the Prime Healthcare network? No, but staying within the Prime network will result in less out-of-pocket costs to you. For services outside the Prime network, a prior authorization from Prime Utilization Review is needed to ensure coverage. While there is no or little copay when utilizing the Prime Healthcare network, higher copays and costly deductibles may apply outside of the Prime network. Your copay amounts are listed on your member ID cards, or contact Prime Customer Service if you have any questions. Will my privacy be respected if I come to the hospital where I work for care? Yes. Even if you work at the hospital where you receive care, your privacy is protected by the law. No matter where an employee works in the hospital, they must be aware and understand that all patients, including employees who are patients, have a right to protect their privacy. This right is guaranteed under the Health Insurance Portability and Accountability Act. As a patient in the hospital, you have the right to control who will see and use your protected health information. This means that communications with or about your health information, including whether you are even a patient, will be private and limited to those who need the information for your treatment, payment, and healthcare options. Prime Healthcare has a zero-tolerance policy regarding HIPAA violations. If your dependent lives out of your Prime Hospital's area and cannot access the Prime network, contact your local HR representative. They will ask you to provide proof of the out-of-state residence for your dependent, such as a college acceptance letter, state driver's license, student ID, report card, or court documentation showing place of residence for dependent children. Customer service will then enter a 12-month authorization into the Prime Healthcare claims system, allowing the dependent access to the Tier 2 network for PCP office visits. Specialty services require referral from your PCP along with authorization from the Prime Utilization Review. If you're out of town and become injured or sick, rest assured that as a Prime member, you can receive care at any Prime facility across the nation, including 45 hospitals and more than 100 outpatient locations across the United States. Of course, if your situation is an emergency, please go to the nearest hospital. If it is not a life-threatening emergency, customer service can help you locate a contracted provider to minimize any potential cost to you. Call the Keenan customer service number on the back of your medical ID card or Prime Customer Service. You can also locate a Prime provider or facility at primehealthcare.com/EHP. We've mentioned referrals and authorizations several times in our explanation of the EPO plan, so now let's review how referrals and authorizations are provided by Prime's Utilization Review Team. What exactly are referrals and authorizations, and who issues them? A referral is the request your provider or physician submits to refer you for services. An authorization is an approval by the Prime Utilization Review Team for the services requested from a referral. An authorization is often needed by providers or facilities to provide services to a member. Now that we have learned the difference between a referral and an authorization, here are examples of when they are needed. As you can see, when you seek services through the Tier 2 network, you need both a referral and authorization. When you stay within the Tier 1 Prime Healthcare network, you do not need a referral to see your primary care doctor, and you can receive in-office lab work at your doctor's office after your physician submits the referral request. While you take a moment to review this chart, let's hear from another EPO member. I had a healthcare issue which needed to be addressed quickly by my PCP, an employed physician at our hospital. His team got me a same-day appointment. He assessed my concern and referred me to our general surgeon for consultation. It was a seamless and timely process that provided me with exceptional care and compassion. I could not be more confident in our plan. Jennifer, from a Prime location in the southern region. While you don't have to worry about learning the details of the referral process because your PCP submits any referrals needed on your behalf, it's good you are aware of how our process has improved. Prime Healthcare has built an automated platform for referrals called Prime Authorization System, or PAS. Many authorizations are now instantly and automatically approved. In fact, more than 60% of specialty referrals are now automatically approved with average turnaround times of 2 to 3 days for urgent authorizations and 7 days for routine authorizations. The platform is available for all providers to use to automate their referral process, and access can be provided to providers by emailing ehp@primehealthcare.com. Physicians can also still submit referrals by fax. The authorization process is followed when members need services not offered at a Prime facility. If you require services that are not available at a Prime healthcare facility, your referring physician will submit a referral request for utilization review to Prime Utilization Review via the online automated PAS tool or via fax. Prime Utilization Review will arrange services with a contracted Tier 2 facility. We will make every effort to make this process as seamless as possible. Keep in mind, there may be out-of-pocket costs, such as deductibles and co-insurance, when utilizing the Tier 2 network. Members should wait for an authorization before receiving services. Doing so will ensure the services will be covered by your plan. You will know when you are authorized to receive services under your plan when you receive a referral authorization form in the mail. The referral authorization form lists the services authorized and the provider who is authorized to provide those services. Non-urgent referrals are processed within 3 to 7 business days. Urgent referrals are processed within 72 hours and often within 24 to 48 hours. Let's hear a member experience. My daughter needed tubes in her ears, and thanks to our amazing network and quick work by our physicians, I found an awesome ENT. She is now ear infection-free and our whole family is happy. Anne, from a prime location in the Midwest. Do I need an authorization if I choose a PCP outside the Prime Healthcare Network? Yes, you will need authorization from Prime Utilization Review in order to access a PCP within the Blue Cross Blue Shield network. However, for pediatrics, your family can continue to see your general pediatrician for all primary care office visits if they are part of the Tier 2 network. Pediatric specialists and non-preventative care testing require a referral from your general pediatrician and prior authorization from Prime Utilization Review. Remember, choosing a PCP outside the Prime Healthcare Network will often result in higher copays. Where can my provider or I find a list of covered services that can be performed in my provider's office and do not require prior authorization? You can find the list of covered services by specialty on www.primehealthcare.com/EHP or contact Prime Customer Service. What if I have a chronic condition that requires me to see my specialist on a regular basis? You or your PCP can submit a request for authorization for specialist care for your chronic condition. An authorization to see that specialist can be provided for the calendar year. However, any testing, procedures, or services must receive prior authorization. Do you know where to go for medical services so that your care is covered under your medical plan? Learn more in the section that follows. First, let's hear a member experience. I have a shunt for hydrocephalus from an accident I was in over 5 years ago. About a year ago, I started experiencing headaches, whooshing noise, dizziness, and cognitive issues. I went to the emergency room at Desert Valley Hospital and had a CT scan where it was discovered that I have slit ventricle syndrome. No one else could figure out what was wrong. Since then, I've had treatment and had my shunt adjusted, and I remember how it feels to feel good. I only paid copays, and my managers and directors were so supportive. If it weren't for Prime's great health network, I would still be suffering. Karen, from a Prime location in California. In an emergency, members should always go to the nearest hospital. Copay and coinsurance payments are based on whether the facility is contracted within Tier 1, Tier 2, or if it's out of network. Any care provided in Prime hospitals, including emergency care, will be covered with no deductible. But remember, if you are hospitalized in a non-Prime network hospital, speak up and let the hospital and provider know they must contact Prime Utilization Review to receive authorization, or the care you receive may not be covered. For after-hours, non-life-threatening situations, you may seek care at an urgent care with either a Tier 1 Prime Healthcare Network provider or at a Tier 2 location. To find an urgent care near you that will be covered under your plan, call 888-773-7218. Do you know where to go for labs, tests, and outpatient procedures? If you guessed your nearest Prime Healthcare hospital, you're right. Lab work, imaging, tests, or outpatient procedures should be completed within a Prime hospital for maximum coverage. Prime Healthcare is honored to help families grow and to care for our tiniest members every day in our hospitals. Going to a Prime hospital to deliver your baby and selecting a Tier 1 provider for maternity care will provide the least cost to our members. Many of our hospitals provide cancer care for members of our community. However, if one of our members has cancer and the Prime Healthcare Network does not have cancer care in their area, we want to ensure the member has access to quality care. If you require care that is not provided within the Prime Healthcare Network, you will be referred to a facility within the Tier 2 network. Your PCP can submit a referral to Prime Utilization Review for authorization of these services. Let's hear a member experience. My annual mammogram at my hospital is a very seamless process, from getting scheduled to getting the bill paid. I had no problems at all with the process. Diana from a Prime location in the Midwest. Next, we will cover some of the most commonly asked questions about claims and the explanation of benefits document that members receive in the mail. What should I do if I get an explanation of benefits and it shows I have a responsibility to pay? An explanation of benefits is not a bill. It is an explanation of how your benefits were applied to your claim. Carefully review the explanation of benefits to understand what has been covered and what has not. A claim can be denied for various reasons. You need to know why so you can contact the appropriate party. The largest cause for denials is that the provider sent the claim to the incorrect location. This is typically an error by the provider that can be fixed by simply resubmitting to the right location. Why do you have a copay? Your deductible, copay, or coinsurance is calculated according to the tier of the provider network rendering services and the type of service you received. Your copay is the fixed amount you pay to your provider at the time of visit for a certain service. Your health plan pays the rest of the cost. Let's hear a member experience. With MERP, I've never had to pay out of pocket when I go to the doctor, and I don't even pay the copay for my prescriptions. MERP is seamless and a great benefit for those who have other options for coverage. Mary from a Prime location in California. Why was I sent to collections? Prime Healthcare does not send members to collections. Providers may send members a bill and subsequently to collections if not resolved. Please reach out to your provider directly or the organization listed on the bill received. If you have concerns about a bill received, please contact Prime Customer Service before you are sent to collections. Please be sure to always open correspondence from Keenan so you can identify errors early. If the denial was an error, it can be corrected before the provider sends to collections. Prime does not want any of our members to be directly billed by providers for services that were approved and authorized by Prime Utilization Review. If this occurs, we will work to protect you and resolve this. Please call Prime Customer Service at 877-234-5227. Lastly, here are more of the frequently asked questions and important contacts you'll want to know. If I access an urgent care in the Tier 2 network and lab work is required, do I need to return to a Prime facility to have the lab work completed? No, you do not need to travel back to a Prime facility for lab work during an urgent care visit. The lab work will be covered at the urgent care center as long as the provider is contracted with the Tier 2 network. Urgent care services are covered only when provided by contracted Tier 1 or Tier 2 providers. We recommend that before you need urgent care, call Keenan to find out which urgent care near you is in the network. This will prepare you in advance. If it's not in network, you may be billed by the urgent care. No one likes to be surprised by a bill they didn't expect. We work to protect our members, and we encourage you to notify your treating physician and non-Prime facility so that you'll receive prior authorization for any services. If not, the services may not be paid. Remember, it's your right to ensure that your providers get appropriate Prime UR authorization for your care prior to receiving services so that you have limited to no financial responsibilities. For all the right reasons, you are required to see your primary care provider before seeing a specialist. Your primary care provider ensures care coordination, which in turn leads to the safest, most effective care. Before you visit the specialist, your PCP will send Prime Utilization Review a referral notification of the specialty visit. The specialist will determine your course of treatment, if any, during your first office visit, and then submit to Prime UR for prior authorization. Here's a tip. Schedule your second appointment or begin treatment only after you receive the prior authorization in the mail. Unauthorized services may become your financial responsibility. What's new with the Value Plan? This year, members of the Value Plan can access the Tier 1 Prime Healthcare Network at a lower, out-of-pocket cost. Please refer to your 2020 Benefit Guide for details. The referral and prior authorization process for all Prime Healthcare medical plans, including the Value Plan, is handled through the Prime Utilization Management Department. Are you required to stay within the Tier 1 Prime Healthcare network? Yes, for the majority of care. When a required service is available in the Tier 1 Prime Healthcare network, Value Plan members will be directed to the Tier 1 provider. Staying within the Prime network will result in less out-of-pocket cost to you. Is Keenan customer service the same as Prime customer service? No, they are two separate entities. Keenan customer service handles eligibility and benefit verification and claim inquiries. Prime customer service handles provider finder, urgent requests, inpatient admissions or transfers, referral and authorization inquiries. How can I get a replacement or a duplicate copy of my medical ID card? Getting a replacement card is easy. Simply go to www.keenan.com/benefits to set up your online account and download a digital copy of your card. Members can also contact Keenan Customer Service to request a duplicate ID card, which will be mailed to your home address. Temporary ID cards will also be available through your Human Resources Department. Your medical ID card contains important information about your medical benefits, including your prescription benefits and co-payment amounts for provider visits on the front. The back of the card lists customer service phone numbers that you can call when you need help. Remember that even though your copays for Tier 2 are listed on the card, you still need an authorization to visit Tier 2 providers before your visit. Express Scripts administers our prescription drug plan. For your convenience, members can create an online account by logging into express-scripts.com. Prescription drugs can play a vital role in maintaining or regaining your health. Prime Healthcare offers lower copays for a 90-day supply of maintenance drugs that help manage chronic conditions, including asthma, diabetes, high blood pressure, heart disease, and high cholesterol. Your health is important to us, and we are honored to care for you and your dependents. Take advantage of the excellent benefits that we offer you as an employee of Prime Healthcare. If you have any questions, please contact your HR department or benefits coordinator or call Prime Customer Service at 877-234-5227. Thank you.